This chapter will cover the Recruitability Assessment app of the Gentle Lung suite. It is only available with NKV 440 and NKV 550 ventilators.
This video is not a substitute for training on the ventilator and assumes the clinician has read and understands the operator's manual.
As part of the optional Gentle Lung suite of Nihon Kohden ventilator systems, the Recruitability Assessment app is a tool to help clinicians assess how much of a patient's lungs can be recruited and if the recruitment maneuver can be beneficial to the patient. The RA app may be used on patients who are on ACMV or SIMV mode of invasive ventilation and weighing 25 kilograms or more. The maneuver is not available while in SPONT mode. To begin, locate the app's area on the graphic user interface of the ventilator. If the RA app is not in the customized apps area, tap the expansion button to access the full apps panel. Refer to the operator's manual to add frequently used apps to the customized app area. Tap on the RA app to open the application. If the patient's predicted body weight is not entered before starting the RA, a pop-up window will display the minimum required weight message, and the patient information entry button will appear blank in the upper left corner of the graphical user interface. Refer to the operator's manual to enter the patient's information. When the patient data is available before starting the RA, a warning window will pop up to prompt the clinicians to review. Tap the arrow at the bottom right corner of the display window to continue. The RA app may be used in invasive therapy using ACMV pressure control mode. It is executable only after 60 seconds from the completion of the last performed recruitability assessment or recruitment maneuver. The clinician may continue with default settings or change settings at the setup screen of the RA app. Tap on each required control settings to change the value. Use the rotary function of the encoder knob to deviate from the default setting and press the encoder knob to confirm the change. Enter Delta PC. IE ratio, respiratory rate, FiO2. For the maximum pressure allowed, this setting must be below the high pressure alarm setting, otherwise, the start button will not be active. Enter the increment of each PEEP step and the duration of each PEEP step. A graph is visible to allow the clinician to preview the maneuver. The horizontal red line at the top of the graph indicates where the high pressure limit is set. Once done, tap on the Start button to begin the RA application. The ventilator will begin the RA based on the clinician's setting. A new window will display a time progress bar that shows the total time and elapsed time of the RA. The Hold button at the upper left corner of the window allows the clinician to extend the time for the current PEEP step. Press Resume to continue with the RA as programmed. The clinician may end the maneuver at any time by tapping the End button at the bottom of the window to cancel, and no results will appear. The window displays a PEEP time-based graph to show the progress of RA. A second time-based graph below is defaulted to show estimated compliance. This graph can be changed to show another parameter if desired. Refer to the operator's manual to change the second time-based graph to other than the default display. When the RA is complete, the ventilator will resume normal ventilation. A new window shows the results. The RA results are measurements taken from the last breath at each PEEP step on the incremental side, and compared with measurements at the same PEEP level on the decremental side. Recruitable volume is the change between the tidal volume at the highest compliance during the decremental portion of the RA to the tidal volume at the same PEEP level during the incremental portion of the RA. Gain in compliance is the change between the highest compliance during the decremental portion of the RA and the compliance at the same PEEP level during the incremental portion of the RA. A vertical cursor appears on both graphs along with the measured values for the current cursor position, clinicians can move the cursor using the encoder knob to view measured results. Tap on X to exit RA. This concludes the overview of the Recruitability Assessment app.
Thank you for watching.